My name is Akali Samuel from Tasly Crown Stars, Ondo City, and today I will be briefly talking on hypertension and hypotension. I'll talk about the introduction, causes, symptoms, the dangers, and how it can be diagnosed and treated. Talking about the introduction, hypertension is one of the most fearful diseases that kill people silently. And according to World Health Organization, a report was given in 2020 that 670,000 people die of hypertension. And every day, statistics shows that 1,000 people die of this same illness every blessed day. And it affects over 7.6 billion people in the world. Therefore, it is important as an health personnel that we kind of consider this hypertension and hypotension of a thing. Now, what is hypertension? Hypertension can be defined as the rate at which blood leaves the heart and circulates to various parts of the body system. And this can be measured in the systolic, diastolic, and the pulse. Why is it so deadly, and why is it referred to as what? A silent killer. Because most times the causes affect human range based on their age range. Now, we go to the causes of hypertension. We have two types of hypertension, the secondary hypertension and the primary hypertension. The primary hypertension is also known as essential hypertension. This type of hypertension is the one that comes without identifiable cause. You will not see the symptoms, it just develops gradually and it can take decades. Now, primary cause of this type of hypertension. Number one, we talk about genes. This hypertension develops when due to genetic disability transferred from parent to child. Number two, we talk about the environment. Primary type causes of hypertension. Number two, environment. The environment you live in, the poor lifestyles, the decision you make can kind of affect your blood pressure and make it to shoot up. Due to the diet, poor diet you take, lack of exercise can increase this primary type of hypertension. And lastly, we talk about physical changes. This is due to nature. As you start growing toward adult age, we talk about autoimmunity. The cells in your body system start reacting, and this can make the blood pressure to shoot up than the normal level according to WHO standard. Then we talk about the secondary type of hypertension. This type of hypertension kind of develop easily and fastly without a reliable cause. It can shoot up instantly, and it's more deadly and severe than the primary type of hypertension. And what could cause this secondary type of hypertension? This is when an individual have kind of a kidney disease, side effect from medication, intake of legal drugs, and chronic abuse of alcohol. This can cause the secondary type of hypertension. These are just few causes that affect hypertension and makes the blood pressure to be high. Now, what are the symptoms when the blood pressure is high? It gives you symptoms like headache, sleepless night, and dizziness of the eyes. We also have the dangers of hypertension. Talking about the dangers of hypertension, why is it so deadly and dangerous? Number one, hypertension damages the brain. Number two, it damages the kidney. Number three, it damages the lungs, the liver, and the heart. These are the major organs in the body system that without them it can cause death. And hypertension as a whole kind of destroys these major organs in the body system. Talking about the diagnosis, how can hypertension be diagnosed? Now, with the aid of sphygmomanometer, you can monitor the blood pressure. But going to the hospital, most medical personnel just monitor the blood pressure, give you the normal range, which is 120/80. Anything higher or above than this, they'll ask you to go to a chemist or use medication that kind of suppress it. And hypertension is more than that, because the higher the figure, it's more dangerous it signifies. So you use a sphygmomanometer, which Tasly health personnel are very good at. Then talking about the remedy, it is widely believed that hypertension can always be sustained, but with the help of Tasly medications, hypertension can be treated. We also have hypotension. Hypotension is when the blood pressure is lower than the normal range according to WHO standard, which is less than 120/80. What can make the blood pressure to be low? One, we have lack of vitamins, fever, shortage of blood, and weak cells and tissues. This is what makes the blood pressure to be lower than the normal range. Now, when the blood pressure is low, what are the symptoms you kind of get? Number one, lightheadedness. Lightheadedness means feeling the ability to feel you want to fall or feeling dizzy. Number two, headache. Headache is only a signal that something is wrong in the body system. Then number three, we have joint pains, cramps. These are some of the symptoms of hypotension. Now let's take note. There is some people, when their blood pressure is high, they don't feel the symptoms, and once the blood pressure is low, they don't feel the symptoms as well. This set of people believe that it is due to their body system or they are very strong. No, that type of hypertension or hypotension is known as asymptomatic hypotension. This is a situation whereby you are having hypertension or the blood pressure is low, but you don't feel the symptoms. Now, this is the type of deadly hypertension that can kill someone easily because your body system doesn't show the signal. Hence, it is important that you check your blood pressure, and if it is high or is low, you need to treat it, because a lot of people are dying because of this illness. And statistics show that by the year 2030, it is over 213 million people will be affected. So there is a need you kind of treat it. Thank you.